most of us do not ask whether they are doing this, and this can be relevant. Particularly, most conventional practitioners in the United Kingdom are unaware of the possible interaction because of these sorts of products. Probably one of the more common ones that we don't even realise is happening are the cytochrome C450 interactions of people that are on people that are on drugs such as warfarin. Because several of the herbal products actually do induce cytochrome P450. I'm not sure how familiar you are with some of the alternative medical models that certainly are occurring in the United Kingdom, but from the Indian continent, Ayurvedic medicine is very popular, and some of the things that we have seen are cases of heavy metal poisoning, things such as lead, because they have quite a high content in some of the products that the patients are being given by the Ayurvedic medicine practitioners. And we have also seen from the traditional Chinese medical practitioners that some of the products can actually induce kidney and liver failure, and there have been fatalities from this. And of course, if you don't take a history of the patient, you don't realise that they have taken these sorts of products. Because quite often patients don't realise that there are risks. Because of the concerns throughout Europe, there is a new European legislation that says there has to be regulations of herbal products that are available in pharmacy-type shops. And by 2012, any of those products will have to be have a formal license. And I am a member of the committee that's involved. Involved with the regulation of this. Many of the companies are actually being very slow because there is a lot of paperwork associated with getting this, but they will have to by 2012 if they want to continue studying. They have to go through this process. But we are not involved in whether these products work because it's too complicated. And to be honest, most of these products do not fulfill all the criteria that we require of a drug. What we are interested in the European regulation is that the drugs, the herbal products are safe and are high quality. And if you want to become a rich person, you shouldn't be doing Western medicine, you should be selling these sorts of products because it is a huge industry. If we look back 10 years ago, 72% of the American population use one of these health supplements regularly, and about half of them consider that they do reduce their needs for drugs and other medical therapies. And the industry is worth $10.3 billion, which is an awful lot of money. We're thinking about it. The problem is that the customers, and of course these are customers, these are not patients, but most of them are taking them when they are well rather than when they are ill. They like products because they are being natural, and they confuse natural being good and safe. And they have very little understanding of the risk. The other problem with this whole area is that the vast majority of the products on sale have insufficient studies to justify the health claims that they use in their advertising. And therefore, I'm sure that amongst many thousands of products, some of these probably do have biological effects. So that is why I became interested in looking at some of them and using a more scientific approach. And so I'll just give you a flavour of some of these types of products. I think the first question is, it is unclear what is a natural product. You can go down this list and people will disagree where natural products stop. You can start off with completely unmodified, which people would probably say is natural, and then you go to partial purification, or taking out an individual factor from a natural product. And once you absolutely purify a single compound, is that still a natural product, or does that then become a drug? Or you can base the product you're interested in on a natural thing and ethically produce it. And based on most people that talk about natural products, if you make it artificially, it is no longer a natural product, even though you end up with the same chemical, and you can go down artificially modified products to improve the efficacy based around natural material. So I'll just give you a few examples as we go through. Most of you will be aware of honey being used as a medicinal or health product for thousands of years by the Romans. And in the gastroenterology world, people were initially interested that it had effects against Helicobacter pylori, this bacteria that's involved with stomach ulcers. But these studies were actually performed only to be grown on plates. And so when we followed up in clinical studies, it was found not to be efficacious. And probably one of the major ways by which honey is having this effect is because of the hyperosmolar antimicrobial activity. But that does not mean that honey is not useful. In fact, in the clinical arena, it has been shown to be beneficial in people who have severe burns. It's being used in that context. And the reason why honey is interesting in that is because it can clear bacteria from colonizing infected wounds. Probably, again, mainly because of its hyperosmolar effect. And for exactly the same reason, it can be useful against antibiotic-resistant strains. It has been used on some sort of neonates in third world countries to prevent getting serious infections from that. In the area of severe burns, one of the problems that the doctors looking after them have is that if you put dressings on them, and then after a few days you want to train the dressing, if you pull off the dressing, it takes away the heating tissue underneath. So what some studies have performed is by putting a layer of honey in between, it actually makes it much easier to train those dressings, and also has the advantage of it is water soluble or being easily rinsed from water. So that's an interesting application. Something that you probably are less familiar with is the use of deer. This is actually very popular in the Chinese community and is a big industry from places in China and also in New Zealand. All of the claims that have been used in the medical world are not based on any scientific basis. So I won't bother to tell you that numerous ones have been suggested. However, if you think that the deer antler is different to the cow horn, is that the cow horn is there all the time and slowly grows. Every year, the deer grows its horns and grows up to about 6 or 7 centimeters per day of new bone. So there is a lot of interest in the orthopedic, the bone injury area about whether we can use growth factors derived from this sort of area to look at research in that. Moving into an area which I've been actually researching over the last few years myself is a product called colostrum. For those of you that are not familiar with it, when mammals obviously